Every year in the U.S., RSV leads to more than 2 million outpatient visits for kids younger than 5. As many as 80,000 kids in that age group are hospitalized. But there's a new treatment recommended for infants and toddlers who are battling the virus. Joining us now is Dr. Dean Blumberg with UC Davis, and you're probably familiar with him, although in the Zoom box. So
Right.
we welcome you back to the KCRA3 studios.
Thank you.
Let's first of all explain to families what is this new treatment?
So there's a new prevention, which is nirsevimab. It's an antibody treatment, and what it is it's given before the RSV season and during the RSV season, and it works very well to prevent disease.
What is it that families need to know as we're kind of headed into this RSV, cold, flu season?
Well, RSV season has started. We've just reached the threshold where we're starting to prevent it for those children who are at highest risk. We've got this new treatment. We're not sure how soon it's going to be available for every child, but eventually it's going to be recommended for all children 8 months of age or younger as they enter their RSV season, and for high-risk children during their second season. And it works very well. It prevents 75 to 80% of hospitalizations due to RSV.
And who are the children who are at highest risk?
The highest risk children are those who have heart or lung problems, or children who are immunocompromised. And a lot of times those are prematurely born children.
For families or people who are watching who don't necessarily know what RSV is, explain what the symptoms are and how it may differ from some other illnesses that we see this time of year.
Well, it can be similar to the common cold, but it comes on very fast, and then there's a profuse, watery, runny nose. Sometimes there's eye discharge and a lot of sneezing, and so that makes it a little bit different from other causes of colds.
We're talking about the potential for this preventative measure in the future, but what are some of the recommendations right now for vaccines for kids?
Yeah, so I mean, every child 6 months of age and older should get flu vaccine, and we're ramping that up right now because flu season is going to start, and that's really important. And many people don't realize that we know that for the elderly, for 65 and older, that they're at high risk for influenza and complications, but children 2 and under have the same rate of hospitalization as those 65 and older. So we really want to get everybody protected.
And let's talk COVID vaccines. I know that there have been a lot of conversations of late about new vaccines and boosters and that kind of thing. What's the recommendation right now for children specifically?
So there's the new formulation, the XBB 1.5 monovalent vaccine, and that's a better match for currently circulating strains. And again, the CDC and others are recommending every child 6 months of age and older should be up to date with COVID vaccine by either getting 1 or 2 doses of the vaccine, depending on their previous experience with vaccines and their age.
Is there anything else, anything specific that families should be doing to prevent illness? Aside from getting the vaccines, what else should they be doing right now?
Well, hand washing is still important, and that can prevent many of these viral illnesses. And then keep your child home if they are sick so that they don't infect others. And then masking still does work very well. So if you're in a really crowded place where you can't move away from people, like on an airplane, I still do recommend masking.
Dr. Blumberg, always good to talk to you. Thank you so much for joining us this morning. We appreciate it.
Thank you. It's good to be back in studio.
Yeah. Deirdre, back